The debate over President Trump's big, beautiful bill rages on. Lawmakers on both sides of the aisle are making the rounds to explain how it could impact all of us. Today's topic, Medicaid. News 10 NBC investigative reporter Jennifer Lukey shares how all of our hospitals are set to be hit by millions of dollars of proposed cuts to Medicaid.
Well, both URMC and Rochester Regional didn't really want to talk specifics today because things are still fluid in Washington, and they are keeping a close eye on the reconciliation process and how, if at all, these cuts might change. But some of our health centers in the area have crunched the numbers, and they are looking at huge losses if this goes through.
60% of patients who get care at Jordan Health are on Medicaid.
We don't have huge salaries. We don't have, fancy, gadgets and things like that. But we do have proven great quality health care and in a very efficient way. So we're like the best deal in town for primary care.
But if the proposed cuts to Medicaid go through, Jordan Health is looking at a loss of about $1.3 million per year.
Everybody talks about the health-related social needs or the social determinants of health. That's always been what we do. But we need Medicaid to make it happen because a lot of the services don't get paid for.
Under the current bill, the majority of those who would lose Medicaid coverage are people who became eligible under the Affordable Care Act. Those enrollees would face new work requirements unless they have an approved exemption. Republicans say it's mostly able-bodied adults who don't work who will lose Medicaid, but Democrats say it goes far beyond that.
The bill imposes work requirements on people receiving Medicaid and even stricter, more onerous work requirements for SNAP recipients, forcing families with children and people with disabilities to jump through more hoops just so they can prove that they can't work.
The difficult requirements to re-up that every few months, to prove your income or that you're working, all those may impact our ability to see those people and to make the revenue that we need to take care of everyone.
And health centers and hospitals won't be able to look to the state for help.
New York State taxpayers can't make up the difference. But here's what we do know. New York State taxpayers actually save money by making sure that the Medicaid dollars that flow from the federal government to the state of New York, it gets invested in preventative medicine.
Because if not, they say, there will be a trickle-down effect that will impact us all.
It's going to cripple a lot of our hospitals. Our safety net hospitals will have to continue to give care to people who need it because that's their mission, and they just won't be compensated for it.
Again, both the University of Rochester Medical Center and Rochester Regional are still looking at their own numbers. They didn't want to talk specifics with me until they have more concrete plans coming from Washington. Of course, a developing story that we will continue to monitor. In Rochester, Jennifer Lukey, News 10 NBC.
The bill is being debated in the Senate right now, where changes are likely. It will then go back to the House for a vote.